So in the US, the healthcare industry is responsible for anywhere from 7 to 11% of the carbon footprint. And so the US as a nation is the second leading emitter of greenhouse gas emissions globally. China's number one, the US is number two. And of that, of being the second largest emitter, anywhere from 7 to 11% is coming from the healthcare industry.
Hi, everyone. Welcome back to the channel. Today, I am talking to Dr. Neelu Tummala. She is a board-certified ENT surgeon. She also completed a fellowship at the Yale Program for Climate Change Communication and the Op-Ed Project. Welcome, Dr. Tummala. So climate change has been a huge topic, obviously not just in healthcare, but amongst the general population. So today I want to focus on climate change and its impact on health. And just to set the stage and the background for anyone who is watching or listening, why is climate change even a health issue?
So the question is, how is climate change not impacting our health? And so what is climate change? Well, climate change is due to the release of increased heat trapping gases since the pre-industrial times. And so one of the main heat trapping gases is carbon dioxide. And the levels of these heat trapping gases has increased dramatically over the past 150 years, and that's led to global warming. And so there's been approximately a 1.1 to 1.2 degrees Celsius increase in temperature since pre-industrial times. Now, that might sound like a small number, but the problem is the environment in which we live in is changing, and that's affecting our health. And so one specific example is heat extremes. 2023 was the hottest year on record. January 2024 was the hottest January on record. February 2024 was the hottest February on record, and March 2024 was just called the hottest March on record. These are not records that we want, because the whole idea is when you have global warming, what the Intergovernmental Panel on Climate Change, which is a United Nations convened group, is showing is with that warming, there's more extreme heat events. So every fraction of a degree increase in warming is causing more extreme heat events that the world is exposed to. And we've experienced this. We saw this last year with the heat records being broken. And then just like I said, January, February, and March, we're seeing all these heat records being broken. And so when we think about what do those heat extremes do to our body, they cause significant amount of thermal stress. And so that increases cardiovascular demand, puts a lot more strain on our heart. And so that increases the risk of things like heart attacks, heat stroke, and heat illness. So we think about outdoor workers, right? They're like outdoors working for hours. They're picking the blueberries and the strawberries that we're eating. And you think about all of the heat that they're exposed to and their increased risk of dehydration. And ERs have actually seen an increase in the amount of acute and chronic kidney disease because of all of the dehydration that these outdoor workers are being exposed to and the amount of strain that that's putting on their kidneys. Another example as an ENT is pollen allergies. So increased CO2 and the warming temperatures is making pollen allergies worse. It's making the pollen allergy season start earlier in the year because temperatures are warmer. And then it's also causing fall pollen allergies to last longer because temperatures are warmer and ragweed sticks around longer than it used to. I'll give you one last example before jumping off this health train, but infectious disease is another one. And so here in the US, we're seeing changes in Lyme disease, West Nile virus, because of these changes in temperature and precipitation patterns. And this is also a huge concern globally when we think about how mosquito and other vector-borne diseases are being impacted by these changes in temperature and precipitation patterns, and who are the populations that are being exposed to these worsening spread of certain infectious diseases. And so that's just like the tip of the iceberg of how climate change is a public health concern. We talked about heat extremes, infectious diseases, and pollen allergies. And when we continue to have more warming and the environment changes, we're expecting to see more and more different health impacts.
That's crazy. I did not know that this was the hottest year on record, or at least till this point in time, January, February, and March. That is very scary. Another question I had is a little bit more related to pollution and our health, which I think a lot of people have an easier time drawing a conclusion there. But are there any specific cancers that are related to pollution?
Right. So one of the interesting things is how do we talk about air pollution versus climate change? And there is a lot of crossover, but then there are also their own topics in general. But air pollutants specifically come from the combustion of fossil fuels, right? And that's where a lot of these heat trapping gases are coming from as well. And so there is a lot of crossover between those two. And so one of the main air pollutants, PM 2.5, that is these fine particulate matters that are less than 2.5 microns in size. And so what happens is when you breathe these in, they can impact your upper airway and your lower airway. And so one of the concerns that we have with increased exposure to these air pollutants is increase in worsening asthma exacerbations. But the other one, going back to your original question, is increased risk of lung cancer with prolonged exposure. And so the populations that we really worry about are people who live by highways, people who are constantly exposed to these higher levels of air pollutants because of the communities and the neighborhoods that they live in, and how is that impacting their short and long-term respiratory health because of this short and long-term remodeling that's going on inside the airway because of the inflammation and irritation from all of these particles.
So you had mentioned people that live near highways, and then I'm imagining the same applies to someone who lives very close to like a factory or any kind of, industry that's emitting a lot of smoke or gas into the air. Is it prudent for them to be wearing masks? Like, is there some precautions that they should be taking? Are we making general health recommendations to people based on where they live? Is that something that we should be doing as a
Yeah.
medical community?
Yeah, that's a great question. And honestly, it's such a loaded question in terms of like how do we protect communities who are most vulnerable? I mean, ideally is that we would help clean up these communities in terms of like their environmental risks, right? So we would have more stringent air quality guidelines. We would have spaces for people to go for cooling, like cooling centers, basically during summer heat extremes, to really protect them from these environmental risks. Yes, things like, having air purifiers in your home can be helpful, wearing masks can be helpful, but what we really want to do is try to address the actual environmental irritant or harm itself that these communities are being exposed to. And I think one of the challenges about climate change is that it has always been considered sort of an issue over there. So I don't know if you remember last summer when we had really poor air quality in the DMV area. We were getting all of these like code alerts, people's work was being canceled, kids' school activities were being canceled. It was unsafe to be outdoors. And that was because Northern Canada was experiencing a really intensified wildfire season, and that smoke was making its way all the way down to the DMV area. A lot of the Northeast experienced really poor air quality. And we know that because of global warming, wildfire seasons are more intense and they're lasting longer. And so while global warming is not the only reason that Northern Canada was experiencing this intense wildfire season, it is one of the main reasons that it was. And so as a consequence of those wildfires, we were having poor air quality, and that was impacting respiratory health, and it impacts cardiovascular health. And so I bring up this example because it is, really necessary for us to address communities who are higher at risk, who are exposed to worsening air quality, higher heat extremes, but really everyone is being impacted by climate change and the impacts of climate change on their health. And so this is why we're so concerned about really like making aggressive strides to address climate change to protect public health.
You know what's interesting is when that happened last year, and I do remember it very well because we actually had to keep my children who love being outdoors, like, confined inside, and they didn't understand why we were doing that. But I was wondering, like in that moment, I could feel and see like how the air quality had changed, and it was very obvious. And also like we were getting the alerts and all that. But I'm imagining, and there are populations that exist that are subjected to, maybe a quarter of that, and they don't even know possibly that they're having this impact on their health and their breathing and all this toxicity. Is that something that can happen?
I think if you're constantly exposed to an irritant, you don't even realize that it's something that's irritating your body anymore, right? Just because you're so used to it. I actually had a friend who was visiting Louisiana, and there's this part of Louisiana that's called Cancer Alley. And it's because of all of the environmental risks that are there. And she was describing how when she was there, like all of the smells and everything were really irritating to her nose and her breathing. And her family members that were there were like, we don't see anything. Like this is just kind of how things are because that's how they've lived their whole lives. And so that's what's really unfortunate is because there's this chronic exposure to all of these irritants, specifically air pollution and poor air quality, and people may not even realize that it's affecting their breathing, their cardiovascular health, their mental health. And so then they're just chronically exposed to all of these irritants. And then when we think about the secondary and tertiary health complications that happens because of it, and it's all just because of the zip code that some people live in, that they are dealing with all of these long-term health consequences.
When you say Cancer Alley and the area in Louisiana, is that just a kind of a nickname that, or is there actually evidence to prove that it does have a higher rate of cancers?
No, that yeah, there's been studies that have shown that that area has a higher rate of certain health complications, one of them including certain types of cancer. Yeah, it's a really unfortunate nickname. That holds true.
Are people not being advised to leave that, or is that just not possible due to, certain circumstances? Is there any way that the government can help people leave that area, or is there anything being done?
That's a great question. I don't know, to be honest, what all is being done in terms of like addressing the environmental risks. I know there's been a lot of community engagement to try to improve the area. That being said, it is a very underprivileged area, and so in terms of like the resources that are being allocated to it, I also think that a lot of communities hit advocacy fatigue or activism fatigue in the sense of like trying to like advocate for themselves, push for cleaner air, push for cleaner water, and then at some point, if you're not getting the things that you need and you can't afford to move to a different location, those are not options that are available to everyone.
Yeah, that's really unfortunate and very scary. What else can people living in vulnerable areas do, like within a day for themselves? Like, is wearing a mask prudent? Like, would you recommend that someone who may be watching this, who might be in that area of Louisiana, like, should they start wearing a mask, and what type of mask, and will that help?
So when we think about environmental risks, everyone has different vulnerabilities, right? We see this in our own patients that some people are at increased risk of having certain health complications versus other people despite being exposed to the same factors. So the really big thing is thinking about what is your own personal risk, right? So if you're someone who has underlying respiratory conditions like asthma, then you definitely want to be more cognizant of what is the outdoor air quality. And so checking that on your phone can be helpful. Also, wearing a mask, like you mentioned, can definitely be helpful. Using an air purifier to help improve your indoor air quality, keeping the windows closed, things like that can definitely be helpful. For any of my patients who have pollen allergies as well, we know that pollen can make asthma exacerbations worse. And so really checking pollen levels as well. And so kind of getting back to the question of can people do to protect themselves if they're going outdoors and they're exposed to all of these environmental risks, I would say anticipating like what is the actual risk for that day, and then trying to use some adaptation strategies like wearing a mask can be helpful. As soon as you come home, showering, maybe do like a neti pot rinse, something to like wash out any of the irritants that can be in your nose can be helpful as well. Washing your clothes if you're outdoors, things like that.
So you had mentioned several things. I just want to get a little bit of clarity. When you say mask, like the ones that we've been using for COVID, or is it N95? Is there a specific one that you would prefer?
So the higher filtration, like an N95, is definitely going to protect your airway much more than just a regular mask will. That being said, if you're not able to get your hands on an N95, or if some people aren't able to tolerate wearing an N95, then wearing a regular mask, so something just to sort of protect your nose and mouth, is going to be better than nothing because it provides at least some level of a physical barrier between the outside world and things that you're breathing in.
Hi, everyone. Thanks for being here. If you found this interesting thus far, don't forget to hit the like and subscribe button below. Thanks for watching. So you could also mention to look online to assess the air quality before you go out. What are some reliable websites, or is there an app that you would recommend that patients can go on and quickly check what their air quality is for that day?
Right. So here in the United States, you can go to airnow.gov, so AIRNOW.gov. And if you put in your zip code, they'll let you know about the air quality in your area. And then a lot of times also on iPhones now, I don't know about Androids, but on iPhones, there's also some data that's looking at air quality, and it'll tell you what type of air quality is for that day and what individuals may be at higher risk if you are someone who's like sensitized to poor air quality.
So do you think that wearing masks, as this problem continues to worsen, is going to be pretty standard for us? Or what is your opinion on where this is going? Because I don't really see a way that this gets better without massive, massive impact and change.
So this is like the question that, do we have to change our own lifestyle to protect ourselves from environmental risks, or can we impact enough legislation to make meaningful change so that the environment that we live in is not unhealthy for us? And that is why I am so passionate about this work in terms of thinking about climate change and legislation to address it, improving air quality, and doing everything we can so that we don't have to live in a world where we're all wearing masks all the time. I had a patient, I remember during COVID, and I was asking him about wearing a mask at home. And he was like, Doc, I've been wearing a mask for years. I live right near the highway, and the air quality has always irritated my airway. And so that to me was an example of like, this gentleman had realized that he had to protect his airway years before any of us were thinking about masks in terms of wearing them all the time. But this was like a way of life for him. And what I really hope is that this does not become a way of life for all of us, and that we're really able to push forward the legislation that we need to make sure that we're actually living in an environment that is as healthy as possible. And there's been some strides. The EPA this past year passed, I got to put in a quick plug for the EPA because I wrote an op-ed on this. They passed stricter PM 2.5 guidelines. So basically making the amount of allowable fine particulate matter for outdoor air pollution more strict. And so things like that are really helpful because over time, those are the initiatives that are going to improve the air quality and lower the amount of pollution that we're breathing in.
What does the EPA stand for?
The Environmental Protection Agency.
So when you say they're limiting the amount of pollutants, who does that apply to?
So for this particular piece of legislation, it is specific to fine particulate matter, which is PM 2.5, which is a type of particulate matter. And there's different ways that they regulate the amount of allowable level, but this is like a United States like wide guideline because it's a federal organization that's putting forth these guidelines. And so different states may have stricter guidelines, but this is basically the federal mandate of the allowable PM 2.5 that's in the atmosphere.
So what industries are the most impacted by this legislation?
So it's going to be the industries that are putting out the most air pollutants, right? So this is going to be, the fossil fuel companies that are combusting oil and gas, coal mining facilities. And so there is some concern that this is going to put some additional strain on these industries and these industry practices. That being said, I also don't think you can put a price on improving public health. And so, I think it's one of those areas where, different industries will have to work together to lower the amount of allowable air pollutants that they're putting out to maintain the improved air quality guidelines.
So I just want to switch gears here a little bit and ask about the impact of global warming and pollution on women's health, and are there any specific things that people should know about?
So there's a couple of studies that have been put out over the past couple of years that have really shown how pregnant women specifically are being impacted by global warming. And so there was a great review a couple of years ago that really showed how heat extremes, so that's related to climate change. I was explaining earlier that with global warming, there's going to be increase in heat extreme events, and how poor air quality is impacting pregnant women. And so the two main outcomes that this study found is that both for worsening heat extreme exposure and poor air quality, there's an increased risk of preterm birth and low birth weight babies. And so this is definitely, a significant concern. And these concerns are going to continue to grow as people are exposed to worsening environmental risks. The question, is just how are all of these things impacting our bodies, but then also, of course, the next generation. And then thinking back to the wildfire smoke too, so wildfire smoke has PM 2.5 in it. And so that also has negatively impacted placental health and can increase the risk of low birth weight babies and preterm birth as well.
So anyone watching this that actually wants to change something, what is like the most impactful thing that we as individuals, and I know legislation is a big part of that, but if I wanted to, be completely solar powered and we all went solar powered, is that going to make a dent? Or what are the things that are really the big impactors that individuals can do?
Right. So you hit the nail on the head, right? Legislation is what we need. We need stronger guidelines, making our environment healthier. And so what we can do as individuals is, of course, we can vote. We can vote for people who are going to enforce these stricter guidelines and improve the environment that we live in. On a day-to-day basis, I think there's always these questions of like, does it really matter if I'm using single-use plastic or not? And really, this all comes down to collective agency, right? So like the more and more individuals that we have working together to change our lifestyle and change our practices, the more impactful we'll be in terms of lowering the carbon footprint that we each have as individuals. I'll name a few things, but I am very cautious to lay blame for any of us, right? Like I enjoy traveling, I take flights, and I think that's okay in the sense that I guess I'm saying it's okay that I fly. Um, but I say that because I don't think that this is necessarily like an individual burden. I think that this is a collective societal issue. But really, what we need is like the huge systemic changes that's really gonna lower the carbon footprint from all of the polluting industries that are putting out these emissions. So now that that's said, the things that have been shown to be really impactful based off of some of the data, and again, these are not things I condone. I think we each make our own choices in life, but they're definitely things that have been shown that can be helpful. It is having one less child, and just thinking about the carbon footprint that comes with each additional human, living car free. If you do have a car that relies on gas, then switching to an electric vehicle. And so this is also one of those that I think is just great for health in general, right? If you're able to like walk to work or have like an active, lifestyle versus sedentary by sitting in the car. Avoid things like flying, any sort of vehicle that's going to use a lot of energy. Buying green energy. So if you're whatever sort of energy plan that you're on, if there is like a green energy option, that can be helpful. So basically, that's usually getting energy from renewable energy sources like solar and wind. Eating a plant-based diet. Again, this is not to say that everyone needs to go vegetarian or vegan. It's just to say to cut back on the amount of meat that you're eating. And then little things like, washing clothes in cold water, hang drying your clothes instead of putting them in the dryer. Recycling is one of those that's a little tough. There's, really in the United States, only about 10% of recycled stuff is actually recycled. And so what I really like actually is like reducing the amount of things that we're buying and then reusing things. And so that's just, eliminating the amount of stuff that we're actually buying, but we're taking the same products and we're giving them another life. Or we're just saying, do I really need that? And then not buying it if we actually don't feel like we need that.
You had mentioned flying, and I'm a big traveler too, so I do like to travel and fly and show my kids the world. Um, if you were to choose a transportation form like the train, is that better than flying or driving? It is.
So taking a train is going to have a lower carbon footprint than flying. I mean, I think a part of this depends on like where you're going and distance and stuff. But in general, yes, taking a train is going to have a lower carbon footprint.
Yeah, and of course, if you're in an electric car, then the lowest.
No lower carbon.
Yeah.
Yes, exactly.
But there are some questions about the way the batteries are mined. Isn't that true about the electric cars? Can you comment a little bit about that?
Sure. Yeah, there's been some concern. There's been a lot of concern actually about the lithium that's used for the batteries and how those are mined and the associated concerns with like that industry. This is a really like complex topic, and it's one of those that I kind of see both sides of it in terms of like seeing the pros and cons. And I think that we just have a lot more work that needs to be done in terms of like technology and energy innovation to really figure out how we can continue to move towards renewable energy sources, but then try to like minimize the negative impacts that are associated with mining for lithium.
I want to shift gears one more time because there is something that we haven't talked about yet, which is the impact the healthcare industry has on climate change. How wasteful are we being as doctors?
Unfortunately, we're being very wasteful. So, especially in the United States. So, in the US, the healthcare industry is responsible for anywhere from 7 to 11% of the carbon footprint. And so, the US as a nation is the second leading emitter of greenhouse gas emissions globally. China's number one, the US is number two. And of being the second largest emitter, anywhere from 7 to 11% is coming from the healthcare industry. And Some of these emissions are definitely necessary, right? Like we need certain amount of energy to take care of patients. We need certain supplies to take care of patients. As employees, we have to commute to the hospital. We need anesthetic gases. So a lot of these are necessary, but there are definitely ways where we can cut back on certain energy usage, cut back on supplies that we're using. So just for one example, anesthetic gases. So desflurane has a much higher carbon footprint than sevoflurane. And so for a patient where using desflurane or sevoflurane are clinically the same, we would encourage anesthesiologists to choose the one with the lower carbon footprint if there's not going to be any negative health consequences for the patient. And those two anesthetic gases for many patients are very similar. And so it's really just thinking about what are the things we do on a day-to-day basis as healthcare providers. What are all of the different packages we're opening in the clinic, in the operating room? Are there ways that we can cut back on it? And I think sometimes these things are just done because it's how they've always been done. And so it's really rethinking, do I really need all of these drapes open? Do I really need all of these supplies in this specific set in the operating room? Do I really need everything that's here? Or can I cut back some and not negatively impact patient care? Because that's always the primary goal, is to optimize patient care. But there are definitely ways where we can do that and be more sustainable.
Yeah, it's interesting because it's an issue of sterility and making sure things are clean, but then there's also the economics of the way the healthcare industry works. And I know that, even in ophthalmology, there are machines and things that we buy as ophthalmologists, and then the company or the manufacturer requires us to use these like disposable probes, because, well, let's be honest, yes, it's great that it's disposable and it's sterile every single time, but at the same time, they keep us as a customer continuing to buy those products because we need the product to operate the equipment. So there's a lot of economics involved too, is how do you disrupt that in a way that is sustainable as well, because that's how a lot of these subscription models in healthcare, when it comes from, selling to doctors and having these subscription models where doctors are required to continue to purchase, disposable equipment, where we could potentially just find a solution where something could just be cleaned properly and reused.
Right. That's exactly it. And it's not just the economic component, it's also just the stricter and stricter guidelines, right? And so we need our governing bodies who are overseeing how sterility is done to say, do we really need to be doing this that way? Like, is there actually a negative health outcome from an infectious disease perspective? Some of the times, some of the things that we do, there's not a ton of robust data that's supporting that we really need to like sterilize this in a certain way. Otherwise, there's going to be some increased risk of infectious disease. And so some of the things that are done is done just because like those are the new stricter guidelines that are put out. And so what we really need is like rethinking from a systematic point of view, like, is there actually an increased infectious disease risk if we don't use the single-use product, or if we don't use this sterility method? Or is using a different method or a reusable product going to be just as clean and not increase the infectious disease risk? And then arguably potentially have lower long-term health consequences because you're not contributing to the carbon footprint of healthcare delivery.
Super fascinating discussion. I've learned a lot. I hope everyone watching learned a ton. Any final kind of parting words for people that are watching that want to make a difference, that want to impact the environment in a positive way?
Right. So first off, thank you for talking about this topic. I know you may not realize it, but you're just having this topic on your platform is like a huge climate activism, like A plus, right? Because you're talking about it, you're raising awareness. So thank you for having me, Saya, and for having this conversation. I think the biggest thing is really just like raising awareness, like we're doing here. Like I said, this is a really important year to really vote, and we want to vote for green candidates who are going to make the environment we live in healthier. And for any healthcare professionals out there, there are so many health organizations who are really taking this on. And so for me in Virginia, there's a group called Virginia Clinicians for Climate Action that I've been working with that works on Virginia-based legislation. But there's also a huge group called the Medical Society Consortium on Climate and Health that you can get involved with and join their listserv. And so, we really need a lot more health voices talking about this. So if anyone's interested, also just feel free to reach out to me as well. But we really would love to have anyone out there to join the force and to really say that, climate solutions are health solutions, and that we want more people and more healthcare providers specifically raising awareness.
Awesome. Thanks for being here.